Okay, it's real important to point out the good features of the surgery, and I would like to talk about that exclusively. But we're not in fantasy land. You know, we're not, you know, Tinkerbell is not here, and so it means that the powerful therapy, the mini gastric bypass, which causes massive weight loss and improves or cures diabetes, causes 100 or 200 pound weight loss, which is a very powerful and very safe surgery, is not perfect. There are some very significant risks to go with those benefits. One of the things the surgery does is it lowers blood pressure. It causes swelling and edema to come out of the legs. It causes water to come out of knee joints, so there's less pain in your knees and out of your back and in your hip. The fluid comes out of your bloodstream and your blood pressure goes down. The fluid comes out of your lungs and breathing is better. The fluid comes out of the skull and the brain and the sinuses, so headaches often get better. So there's a huge benefit that goes with the surgery, but along with those benefits are significant risks. And one of the risks is that the power of the surgery can be too darn much. So for example, I operated on a husband and wife, and it was Snow and Raymond James. Snow was the wife's name, and her maiden name was White. So yes, I've operated on Snow White. And her husband, who was a Baptist minister and a mortician, which I don't think is I don't think that's a conflict of interest. I think that's okay. But he called me and said, something's wrong with the surgery. I'm vomiting all the time. And I said, well, tell me, what do you eat for breakfast? He says, I don't eat breakfast. I rush to work because people are dying to get... I rush to work, and then I skip lunch because I'm so busy at lunch. And then I come home and I try and eat a big dinner, and I throw up. Can't do that with an MGB. You need to eat a little something when you wake up. Before lunch, at 10 o'clock, around 2 hours later, you need to have a snack. And then at lunch, you need to have a little bit of lunch, but you can't have a big lunch. And then before dinner and after lunch, you need to have a little snack. And after dinner, before you go to bed, but an hour or two at least before bed, you need a snack. If that's too much and you don't like that, it's not a good choice for the surgery, because when you try to get around those things, to ignore those things, you can get weak and tired and sleepy. We've had people drive off the road, potentially. We've had people get weak and tired when they're walking or hiking or doing things like that. So you have to be cautious and careful if you have the surgery. Now the surgery, as I say, is very powerful. But along with that power goes some responsibility. You have to be careful in how it's used because it's so powerful. It's a little bit like if you owned a Ford pickup. You might never change the oil. You might never get maintenance on it. But if you buy a red Ferrari, you got to do some maintenance. It takes more effort to manage that Ferrari and to care for it than it does that beat-up Ford. And the same thing's true with the MGB. If you want to stay where you are now, you don't need to be as meticulous as what you eat. If you lose 200 pounds with an MGB, bypassing the gut, there are some well-recognized complications that we get from our patients, information that we know we can tell you about. And one of them is you can get weak and tired and washed out and dehydrated if you're not cautious about keeping up with your fluids.